Maybe, Adrian, I'm going to start with you if I can, because one of the threads that was the most powerful across basically every question that we asked in the survey is this notion of people with lived experience and the centrality, the essential distinctiveness, just the power and potential that comes from smart, sustained, thoughtful, significant experience and engagement with people with lived experience. And I wonder if you can just talk a little bit about your perspective on not only why that's so important, but the mechanics of making sure that continues well beyond today.
No pressure. I think that one of the successes of the last few days is that the progress is in the process. So all of us being here, working together, encountering each other as human beings and people with unique expertise is one of the great successes of the last few days. And that includes people with lived experience. So you've encountered us, you sat in rooms with us, you realize that we're not just moms. So I can tell you that as a person with lived experience, a lot of my identity during that process was, hey, mom, we have to do this now. Hey, mom, did you know? It wasn't my name. It wasn't who I was as a human or a person. It was just, I was a person in the room that needed to be informed and needed to help. And I think that the last few days, based on the slides that I've seen, unless the people with lived experience kind of infiltrated that and inserted what they wanted you to know, I think the last few days has really demonstrated the value that we bring to the conversations, the knowledge that we have both within our experiences and the skill sets we bring from outside of just those experiences, because we have a lot of knowledge and expertise that even goes beyond what happened in those years where we had to work closely with all of you. And I think that the commitment we got from the government demonstrates that. That was groups of people like me who got together and figured out ways to get that money to come to us. And that is a really strong skill set. So I applaud all of you for welcoming us these few days, including us in the conversation, and allowing yourselves to be formed with us and by us. And that's what's going to make a difference in this organization, is that we allow each other to change and to form together. We're not going to come in and be the same when we come out of it. So I think that is a big strength. Does that answer your question? Okay.
That's awesome. Thank you. Christine or David, do you guys want to build on that, or?
Maybe just a personal reflection. Please. I've had the privilege in my career of working with patient partners and seen that idea and philosophy evolve a lot over the last 15 or 20 years, but I've never seen it as involved and as effective and as embedded as I've seen it in this community. And I've also talked with Adrian a few times about how I think it's a different perspective being a parent of a patient than having a patient partner. So I'm more used to the model of working with adult patient partners who have decided to take their experience and contribute back. But it is a different lens being a parent of a child and being a partner in this work. And I'm still learning what that means. But Adrian and I have spoken a few times about the fact that it can come from a really strong place of trauma, and that there's a different relationship and a different way to engage with people who have had that experience. And I'm a parent too. And so I think I can feel that, have an empathy for that, but I can't completely understand it ever. So I think being aware of that and that it's a different relationship with patient partners has been a huge learning for me. And I really can't thank all of you enough for how much you've contributed to this already, and how vulnerable you've been willing to be, and how much of your personal stories you've shared. So I find it very humbling, and also a huge power of this consortium.
Thank you for that, Christine. That's awesome. David, I'll come to you if I can. You started to talk a little bit about the power of sort of cross-theme, all of ACCESS ambitions and objectives yesterday in your closing remarks. And the survey suggested a number of areas where kind of opportunities could be unlocked and work could be focused. Do you want to reflect a little bit on what you see as most important, and what maybe the right balance is between some of those really ambitious, audacious 1 or 2, and then some of the kind of more achievable, shorter term, more modestly resourced ones.
Yeah, sure. I mean, I suppose I'm one of just my thoughts. I think all of us, that's one of the reasons we've had the last 2 and the full 3 days of this, is to gather those and articulate them. I mean, in a very practical way, and we had a little discussion after, one big overarching project, if you will, or overarching ambition, as somewhat dull as it sounds, is the opportunity to actually create one complete database of everything. The general theory of relative, like everything is encompassed. I don't know what that means exactly. I don't know how exactly we would get there, but we've heard enough conversations about yesterday a lot about different data. I think the point is not to set up yet another database that is genomics for this, or indigenous population database, or this population data, or this. Let's try to figure out a way, can we put it all under one umbrella?
You want a central library, David?
You might be a librarian. I think another opportunity, which touches a little bit on the first question you asked, that I've been reflecting here, is we use, and please take this the right way, we use the term people with lived experience, which I think we're meaning is parents and children with cancer and parents of children with cancer. The other flip side of people with lived experience is all the clinicians who live it in a different way, as you pointed out, empathetically, because we don't have a child with cancer, but the nurses, the social workers, the psychologists, the physicians who spend their entire career with many, 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 many peoples of lived experience, and those lived experiences are very different. And one of the thoughts that crosses my mind is this is one of the first opportunities that we're hearing that there are opportunities to think about how do we take the individual experiences that each of us has, whether a parent or a child or a practitioner, and come up with I don't know if mechanism is the right word, but come up with a system that allows for the unique aspects of those relationships, but it also teaches us something about how to do it better as globally.
Well, I have a thought for you, David. I'm jumping in. Is anyone here surprised? One of the things that I would really like to build for this organization is a persons with lived experience inclusion framework that does exactly what you're saying. Ideally, it would be grounded in a trauma-informed approach, because something that I've heard a few times while I've been here is, I've had this experience, I'm a researcher, I'm a clinician, I'm a person in the sciencey end. But does that make me a person with lived experience too? And my answer is 100% yes. And something you may not know is that we as the mom know that you have feelings. We know you've had a hard day with us.
That's why we're sitting in front of a fire.
I know.
Kumbaya.
But we have to respect that patient-doctor relationship during that phase, because it's needed and it's required. But we understand that. We honor that and we respect it. But now we're trying to create a place where we can go beyond that together.
I mean, just to extend this philosophical discussion, how do you do philosophy at 9 a.m? I don't know. But anyway, it's the fire. There's an amazing study that was published out of the Australian precision oncology group, Zero Cancer, where they basically interviewed, they've done several, but this was an interviewing, semi-qualitative interviews of bioinformaticians, technicians in the lab, people drawing the blood on patients who were then getting sequenced, and so on, all the back room of the precision oncology of what their what the impact of what they were doing was on them. And the qualitative comments that they make are remarkable. These are people who have zero patient-facing roles, but their role is, they see as incredibly empowering and also humbling, that if they find an alteration, they're the first person to find the mutation in the BRAF gene in a patient that they then know will be able to get a drug. And that's a very interesting experience to explore. And we haven't done anything like that here. And I think we could.
No, I feel the way the system works now is forgets that we're humans. And I would really like this organization to remember that and remind us of that and allow us to work together as humans. And I think that there's a framework that we need to build that will allow that, to build spaces for us to work together and discover those relationships, feeling a little more safe about it. Creates a culture that is different from the one we're coming out of and then coming to this space together, because they're very different cultures. Something I've encountered a lot for people with lived experience, which I think we're going to have to change that because everyone has experience, is that they're not used to that medical or academic interrogation style format of communicating. It's quite disconcerting if it's not your day to day. And it can happen quite fast in meetings in this environment, that it switches to a very assertive, I won't go with aggressive, that's a little too harsh, but a very assertive interrogation of each other's ideas, which is not a format that a lot of people are aware of or familiar with if you're not in the discipline. So I agree, David.
Thank you guys for that. That was a really important conversation that is not done. That is only bits and pieces in these moments are done, and many more elements of these themes will be pulled through beyond today. Christine, maybe I'll come to you to ask. This will be my last question, then we'll open it up to all of you guys. Lots of references to sustainability in the survey. And
yes, Christine.
You know, Jim was supposed to answer this question.
You said home
Jim's sick.
under a blanket. Yeah. Can you talk a little bit about sort of, I mean, obviously not a super important subject, not a simple subject. We have some time, we have some money, but we'd like more of both. You want to just sort of share your thoughts a little bit on that particular conundrum?
Sure. So yeah, I mean, this has been a focus really since I started in April. We started talking about it because it was clear that while we build this organization and live in this organization, we also need to sustain it. And maybe that's not the most logical order, but we need to think about it from the beginning. And so I think the most important thing for sustainability of an idea or an organization or a consortium is impact. So we have to think about what our impact is going to be. And we have to, some of the work that we need to do is break down all these incredible ideas and projects and big picture transformative change things into short and medium and long-term impact, because we are living in the short and early medium timeframe. So we need to be able to show that we have had impact and why this is important and why it must be sustained before we tackle, how that happens. And then, so I think that's one thing that we all need to keep an eye on. And then the other thing is that we need to think about different ways of sustaining this. I don't think that I don't think any of us think that just going back to the federal government and saying we need more money, we need more money, we need more money is a good way to do this. We've heard the emphasis on collaboration and partnerships. We need to work with other organizations. We need to think about different ways to bring all these different groups together and connect and think about the big picture of what we're doing, and then think about different sources of funding and how we leverage all of those. I loved what you said in the beginning about no duplication. And I think that's
do not duplicate.
Do not duplicate. And that's definitely part of the gestalt of this, but also part of our sustainability as an organization.
David?
Yeah, I agree with everything you said, Christine, but I'd also warned us a little bit that we can't wait to generate the impact data because there won't be time. We unfortunately have an incredibly short time timeline to get things done, and many of the projects and so on are underway, but they have a relatively long timeline, even within our short timeline. So we're not going to have a lot of quotation marks results to present to the potential partners as much as we might like. So I think developing strategies that we're already starting to go out and meet with these people and talk to them about the consortium and access and so on, and identify our allies in all the various different places. One of the things that has come up many times, of course, and you just brought it up before, Adrian, is that it took 5+ years to get the federal money, and it definitely started with Helena with building out that whole people with lived experience, but it took an MP to hammer it through it, right? And without that, we still might be working. You need to find the right person in that home.
A champion.
Who knows the language, the champion, thank you. And Pam was the champion there. Pam was the champion for Marathon of Hope. There's other people who are champions in others of our partners. So we have to spend some time now identifying who are these people. Otherwise, we're just another lobby, and that usually doesn't work. But we could do it. I mean, there's so much breadth of contact and information, so on. We can do it.
So we're going to turn it back to all of you, but just maybe one thought from the last part of this conversation. As you go off and think about objectives and activities and priorities for Access in your breakout groups, one of the things that we would kind of push you to do is think about different time horizons. So if everything you come back, you're like, yeah, it's really important, really essential, going to take 3 to 5 years. If we have a really long list of that and a really short list of things that we might be able to do in 18 months or 24 months, then we're going to be overweight a time frame that's unhelpful and underweight a time frame that's necessary. So I would urge all of you, as you have your conversations between 10 and 11, think a little bit about the long term, like that, where we can show progress, even if the final results extend beyond this first arc of funding, but also think about things that you think we might be able to do, you might be able to do in a year, in 2 years, within that first time frame, because having a few beginning, middle, and ends to show people is going to be really important.
I'm just going to nuance that a little bit. So I think, and also based on what David said, I don't want anybody to have the impression I don't think we need to do the big transformative things. I do, but I think we need to break down what are the steps that get us there and be able to show that we're making stepwise progress. So it's somewhere between no short-term deliverables and making sure that we have evidence of how we're getting there.
Well said. Okay.